Okay, doctorarjaybe here, and today I wanted to talk a little bit about esophageal reflux. So, what do we mean by this? Um, this is a condition where uh, food or juices from the stomach, instead of going down, come back up again. Um, you can get burning sensation in the chest that they call heartburn, and even sometimes the fluid will come up high enough that you can feel it in the back of your throat. Now, if this occurs at night and you get fluid in the back of your throat at night while you're trying to breathe, it can cause problems with the breathing, and um, so this can be a cause for sleep apnea issues. Um, also, if you have this fluid coming up, um, most of the time the fluid that's in the stomach is acidic, because of the acid that the stomach produces. So if you get some of this fluid coming up to the back of your throat, this can affect you to have a sore throat. The teeth can be affected because the acid could erode the enamel on the teeth. Um, uh, it can cause problems with the sinuses if some of that fluid gets up into the sinus area. So a lot of little things can happen with esophageal reflux. Um, uh, as a matter of fact, when I was in practice, I would send somebody to the ear, nose, and throat physician because they were having chronic sinus problems. And many times the ear, nose, and throat physician would say that there's nothing wrong with the sinuses, but there's evidence of esophageal reflux. So again, this is a situation where the reflux fluid irritates the sinus and a person has chronic sinus troubles. Um, Esophageal reflux is more common with certain foods and drinks. Uh, Caffeine definitely can cause it. So if you're having, just a single cup of coffee, probably not a big deal. But for those people who drink multiple cups of coffee throughout the day, it's more likely to be a problem. Another chemical in our environment that can cause it is chocolate. Chocolate, once again, has chemicals in there, and these things can increase the risk of esophageal reflux. Um, uh, Foods that are high in fat also can cause problems with esophageal reflux. Uh, uh, all of these things tend to weaken the muscle that provides a door between the stomach and the esophagus. When that gate is weakened, fluid can wash back upwards. Um, Also, positioning can cause a problem. In other words, that if you're sitting upright, gravity will have a tendency to pull the fluids into the stomach area and down. If you're laying down, some of that fluid could follow gravity towards your head. And so esophageal reflux is more likely when you're laying down at night. Um, the treatment for esophageal reflux is usually medications that decrease the acid. This allows the problems with the esophagus burning to be decreased and allow it to heal. As well, when the muscle that prevents the reflux becomes irritated with the acid, cutting down the acid allows that muscle to heal, and then it can constrict better and block off the opening of the stomach. Um, uh, Definitely, the meal can have an effect on this also. If you are trying to stretch your stomach out by eating huge quantities of food at one time, definitely, the stomach is distended. It's going to weaken that muscle, by pressure, and cause more reflux. So people who eat smaller meals more frequently during the day tend to do a better job than people who have one huge meal. Um, uh, for this reason, people who skip breakfast and lunch and decide to just eat all their calories at dinner sometimes could be more likely to have this issue. Um, Alcohol can be a problem, definitely. Again, alcohol kind of weakens that muscle again and can cause the reflux, especially if you're eating and drinking, around the same time. Um, uh, so if to take care of the esophageal reflux problem, if you have it, um, uh, decreasing the chemicals in your diet, the caffeine, the chocolate, the alcohol, the fatty foods, um, uh, using some antacid type medication, Pepsid, omeprazole, whatever over the counter to try to decrease the injury, and of course, seeing your physician to check things out. You don't want to be treating yourself for esophageal reflux and finding out that it actually was heart disease, that the heartburn was actually heart pain. Um, so definitely it's a good idea to have things checked out. They can do some testing if it's a severe case. They can have you go see a GI specialist who can take a camera, look down your throat to see if there's any damage to the esophagus, check out the stomach, make sure everything is doing okay there. And this way, make sure that there's nothing that's pathological that's causing the reflux to happen. Okay, so get the general idea, I think, from here, what to do if you have it and how to avoid it in the first place. All right, take care.